name is Aida Shirazi. I'm the program director for the Afghan Women's Breast Health Project. The Afghan Women's Breast Project is funded by the National Institute of Health. The main purpose and the goal of this project is to increase breast health knowledge and use of early detection methods for the immigrant Afghan women of Alameda County.
Hundreds of women is benefited from this program. It brought a lot of awareness and reduced some of the stigma in the community.
We have one of the largest active and refugee communities here. And from a pilot study that we did about 7 years ago, the knowledge and behaviors of the Afghan immigrant women regarding mammograms, we found out that many of the women in the study have not had a history of mammogram, and they mentioned that they had a high rate of family history of breast cancer. So that study led to our 5-year study grant that we received from National Institute of Health, NCI, that allowed us to develop this culturally tailored project to increase the awareness and knowledge of Afghan women regarding breast cancer and breast health.
In the past 35 years of war, women mostly, it was like a taboo. To stay at home, they never pay attention to their health. It's all lack of education. That's why this project helped Afghan community to bring this awareness among them.
They didn't go to the doctor. They are like ashamed if some people knows about their problem. That's why when we educate them right here, they are so happy.
Through this health education classes, the women, since the class was in their own language, because most of them illiterated even in their own language, so we tried to use the terminology the way to make them understand. The goal was to educate them and convince them to do their exams, which was very successful.
And I'm before come to Afghan Coalition breast health programs. I don't know about breast cancer. I take the class and it's very helpful for me, and I know about this breast cancer now.
I was really scared to go to the machine to have mammogram. That pressure bothered me, and they said you have to because you have a history of the family.
In order to get to the root of this problem, we have to educate men and women to overcome this stigma and misconception. Because unfortunately, Afghan women, they don't pay attention to their body.
I have to talk with the husband to tell the importance of the health in general, and especially their wife's health. If you have a healthy wife, of course, it's the base of a household. That's how you have a healthy family. And then first talk with the husband to convince the husband, and then make the appointment for the client, which was a little bit challenging for some family.
Our culture is the man is head of family, and they can to support their wife, mom, daughter, and get have good prevention from diseases.
This program is helped because this is educational and the awareness for Afghan male. They got the point, and they are, I'm sure, after that they said, oh, we have to go to see my primary doctor and ask him about if I need something to be done before something seriously is coming.
That whether the doctor or medical expert is female or male doesn't matter, but your health is extremely important. Why it's important? Because if you do not have good health, you can't worship. So worship and health is interrelated, it's connected. So we have to teach and train people how to adapt to this system and how to integrate to live in peace and prosperity and health and healthy way of life.
The way that program worked, it was for women aged 40 and above. They were from different parts of Afghanistan. They were Farsi speaking as well as Pashto speaking ladies that based on cultural and religious beliefs, and as well as language barriers, that they had no access to get the proper health awareness regarding breast health. So as we based on a very friendly environment that we provided for these ladies so they could connect with us on that level. And we could connect with them on an open platform. We educate them in a level that they could understand us and talk about their own experiences. And we, through their level of knowledge, we provide them that service.
در سابق من نمی‌فهمیدم که ایمیگران چی هست، اما حالی که از وقتی که در این حافظ آمدیم میفهمم که چیست. ما رفتیم ایمیگرام کردیم، مگر حالی میفهمم که برای صحتم برای فامیلیم بسیار خوب است و دیگه ای که کوشش دارم که بازم برم و برای دیگه نفرام هم بگویم که برن معاینات کانسر کنن.
I take the class. Classes is very helpful for me, and right now I know anything about mammograms, breast cancer, and I can help myself and anybody else is needed.
At the end of the class, they were referred to navigators, and their health navigators made appointments for them. They developed referrals for them, and they contacted their providers. They did everything that they could to make sure that these women actually finish the final step and get the mammogram.
Because I have experience working with the community, because of my customer service and the trust that I built with my community. This is the reason I became a health navigator.
These were women who were trained in ideas about breast cancer and how to get a mammogram and how to have, a good nutritious meal. And we had these gatherings of women, 5 or 6 women in the classroom, and they came on a weekly basis and they were educated about these kinds of issues. And as we said, it was a safe environment for the women. Our health navigators and health advisors, now they have jobs that are based on the trainings that they received on this research grant. So they have been able to move forward with their work and their lives.
I work here right now. I'm working at the Newark Health Center. So I recruit a lot of patients by going through the husband. And then the problem is not it's just going through the husband. The problem is the trust in the community. And I had that trust because I've been working with the community, Afghan community, for 27 years. So once we build up this trust and relationship with the patients, so the husband was okay with it, so they start coming forward. So I was kind of the bridge between the patient and the family members.
It's the only project in the United States and as far as we know in the world that is so comprehensive and focuses on Afghan women's breast health, and it's tailored towards the Muslim population here in Fremont and in the refugee communities. One of the unique aspects of this project is that it's called a community-based participatory research. So that means that the community and the research team both have equal role in this project. And it's not only the researchers, dictating what the community needs to do. It's basically a very unique and equal partnership. The community had their own budget, they had their own accountant, everything was based on their own needs, and the same with the research project.
The advisory board a lot of them is more active people in the community, especially women in the community, and they have a lot of information about the community needs and problems. And we talk about each one of the questions, how supposed to be asked with these women, because it's very hard, because it was first time we are talking about breast health. And I think by involving the community together, it made it more interesting and made it very successful.
I'm glad, I'm fine. And I appreciate it, really. This program, really, everybody needs it.
When I healthy, I take care for my family and myself, and everyone is close with me. It is my community, my family, and my country.
The goal is to educate every Muslim woman in this community and in the United States about prevention and about detection of cancer, because cancer is beatable and is treatable.